Hi, I'm Dr. Craig Castanet of Backstrong Non-Surgical Rehab Clinic in Decatur, Georgia. I'm going to talk to you today about whether or not a chiropractor can help spinal stenosis. I treat spinal stenosis frequently. Spinal stenosis, I'll explain, is stenosis can be used in two different ways. It can be used as a description. It's just synonymous with narrowing. So you can use it as a description when you're describing imaging studies, particularly MRI scan, where radiologists measure the dimensions of the spinal canal and qualitatively look at the neural foramina. That's the little holes on the sides where the nerves exit the spine. So we can use it that way as a description. And in that sense, it has less significance than when we use it as a clinical or a term to describe a clinical presentation. The clinical presentation of spinal stenosis is the one where you see people in public, they're bent over, they can't stand up straight. Typically, these people will lean on a grocery cart if they're in a grocery store. They have a flat back. They cannot assume the normal curve in the low back that we all have, well, that most of us have when we're younger. This narrowing results in compression of the nerve roots that run down the spinal canal. This stenosis is most common in the low back, but you see it also in the neck where it's a different clinical picture, and I can discuss that in a moment. But lumbar spinal stenosis is the very common diagnosis. And again, as I say, I describe the clinical picture about how they are bent over, they can't stand up straight. Their walking is limited because when you try to stand upright and you walk any distance, once you have the presentation of spinal stenosis, the spinal canal is so narrow that you bend over to open up the space. Let me show you a model to describe that. If the person is like this upright, and these are two vertebrae, this is their back, these spinous processes are what you would feel if you ran your finger down the midline of someone's back. So their abdomen would be in front here, their back is right here, and as the canal becomes narrow and I didn't tell you why that happens. That happens because of the degeneration and enlargement of tissues, including the joints, the ligaments near the joints, discs that may bulge out, and a host of degenerative enlarging changes in the spinal canal that makes the hole right there where the nerves pass smaller. But if you're upright and you're walking and you have spinal stenosis, you can make a little more space in there by bending forward like that. And if you do that at several segments, you can see that you would make a good deal more space. But you can't do that for very long. It's exhausting to walk that way. And nonetheless, these people end up pinching the nerves that are in the canal even when they try to accommodate this stenosis with their gait pattern and their posture. So that's the clinical picture of lumbar spinal stenosis, which is oftentimes surgical. But in the beginning, and this process takes essentially years and even decades to slowly progress, and it tends to slowly progress over time. But in the earlier stages of it, when there's back pain and it's not severe, but it's narrow, the person will typically, by medical physicians, be sent to pain management to do injections. Obviously, the injections don't do anything to change the anatomical problem of the spine. But it's meant to be therapeutic or palliative for as long as the person can manage the problems in that fashion. But just as reasonable a fashion, and I would argue a better choice up front, is to decompress the spine. So when I treat patients with spinal decompression, I put them on a table, I secure their anatomy to the table. The table separates these vertebrae. So let's imagine they're lying on their back this way. It separates their vertebrae. It does so at several levels. It creates a little more space, and given this treatment, they may be able to manage their symptoms and signs for many years before they need pain management or surgery. It's hard to say whether or not pain management will help if spinal decompression fails and vice versa. But they're both worth trying. It's just that injections are invasive, and if spinal decompression, a mechanical anatomical approach to the problem is effective, that's a better choice because there's less risk and it does make some anatomical improvement in it. Again, I treat many people with lumbar spinal stenosis, and when it's not very severe, it often helps them for many years before they need pain management or lumbar surgical decompression for their problem. If I can help you with your lumbar spinal stenosis, give me a call, 404-558-4015. I'm Dr. Craig Castanet at Backstrong Non-Surgical Rehab Clinic in Decatur, Georgia. If you'd like to learn more, and I post a variety of videos on my website and also my YouTube channel that discuss lumbar spinal stenosis and a whole host of other problems, including cervical spinal stenosis, which I did not address in this video. I don't want it to run too long. So call me if I can help you. Go to the website, backstrong.net, and I look forward to hearing from you. Thanks very much. Bye-bye.